Connect. Hello.
Good evening.
Are we live?
I think we are.
Here we are. Well, my name is James Southwell-Keely.
And I'm Lisa Rush.
And we're here from Woollahra Health and Beauty. What are we talking about tonight, Lisa?
So our topic of conversation tonight is sun-damaged skin. Can we reverse the effects of it? It's my first Facebook Live, so I'd love it to be as interactive as possible. So if anyone is out there watching, please like, share, tag your friends in, and please ask me some questions. And yeah, this is all about you getting as much information as possible.
Absolutely, and it's in a finite period of time, so send them through at any time. We might not address them right then and there, but towards the end of the night, towards the end of the session, we will get to them, promise. Now, also, any questions you have about a sunspot or wrinkling around your eyes or anything that may pertain to what we're talking about tonight, send through the website. If you go to the website, woollahrahealthandbeauty.com.au, down the bottom of the page there, scroll to the bottom, you'll find a little area to submit your questions. And that can be about anything. We are talking about sun-damaged skin, prevention, reversal and treatment. So, tell me, why do we get problems with the sun? Tell me about what the sun does to us.
Well, our skin is our biggest organ in our body, and we get a lot of exposure to ultraviolet rays, which can be very damaging to the skin. We're all very aware of the UVB rays, which are your burning rays. You know, when it's a hot sunny day, we can obviously get sunburn, we get a bit of a tan development, which we may think is quite healthy and looks quite cool, but in actual fact it's a bit of a protective response from the body. And we know that over time, the more sun that we get, it creates a free radical cascade within the skin, which results in damage to the collagen structures. We get inflammatory issues in the skin. So it does accelerate premature aging. And then obviously we've got that issue of skin cancers that can potentially develop as well.
Absolutely, yeah. We're a country that has a diverse racial mix of people, but there's also a lot of pale-skinned individuals like Lisa and myself, and we're particularly prone to developing precancerous and cancerous conditions when exposed to the sun. Australia has the highest incidence of skin cancer in the world, and in fact skin cancer is the most common cancer in the world, and it's for that very reason. I mean, the Aborigines who came here 50,000 years ago have beautiful dark skin that protects them from these UVA and B rays you're talking about. But we're completely exposed to it. And then there's every colour of skin in between, every skin tone that's more or less susceptible depending on that mix they have.
Yeah.
So we like to be out and about in Australia, but how can we protect ourselves? I mean, what is the sun doing to us?
Yeah.
How can we still be out there and enjoying ourselves and still be protected?
Well, we know that the sun is going to potentially accelerate our premature aging, and obviously then, you know, potentially lead to the skin cancers. So it's about thinking and incorporating simple strategies to look after the skin. So we're all very much aware of the slip, swap, slap. I believe the health promotion thing is here in Australia, but essentially, you know, sun protection day to day. SPF is crucial in the morning as part of our daily routine, and I believe the Skin Cancer Org actually stated a fact that if a person wears SPF on a daily basis, their skin actually ages 25% at a slower rate compared to somebody that doesn't wear it. So that's a good motivator in itself.
It's unbelievable.
Obviously wearing hats, not going out in the middle of the day, all the simple strategies.
And so what are the sort of things that early sun exposure will cause?
Yeah, absolutely. So, I mean, look, we're all aware of sunburn if we go out on a big sunny day.
Yeah.
But when I have patients...
Even on a cloudy day.
Absolutely, even on a cloudy day. But often when we have patients come into the practice, you know, we can start to see early signs of sun damage, you know, in your 20s. So that could present as, you know, mild redness in the skin, so increased inflammation in the skin.
Yep.
We might start to see mild pigmentation. We may also then start to see things like fine lines and wrinkles where we've got elasticity changes. Now, obviously, the younger the client and, you know, the less damage there is, obviously, the more we do to strengthen that skin and start active skin care, skin treatments to really boost and restore and protect that barrier. Obviously, we can, you know, prevent and delay those aging signs a little bit more. Obviously, the more severe the sun damage gets, we start to see obviously worsening in inflammation in the skin.
Yep.
Those
fine wrinkles
fine
become
lines
deeper
turn
wrinkles.
into deeper wrinkles that we can see at rest. And then obviously the more severe clients, you can actually see that real elasticity loss, and
Yeah.
they've got those really defined lines all over the face.
Descent of the tissues, sagging of the tissues.
Absolutely.
Yeah.
And they can be best dealt with, obviously treatments that, help to resurface, could be laser, things like microneedling to boost and stimulate collagen. We've also got things like ultrasound technology to boost collagen production.
So if we're doing a laser, what level of the skin are we penetrating to affect those changes?
Yeah, absolutely. Well, it depends on what sort of laser that we're using, but obviously things like your resurfacing laser, that may be taking off some of the very top layer, your epidermal layer,
Yep.
and also then penetrating down into your next layer, which is your real sort of goodness layer, where you make all that collagen and elastin to really boost.
So that gives the skin the strength, that deeper layer.
Absolutely.
But the superficial layer is also where the pigment cells lie.
Absolutely.
So in resurfacing and giving the skin a fresh start,
it's going to stimulate pushing those damaged cells off, and then stimulating a healthier neural response at a deeper level.
and what else can we do to stimulate that deeper, the deeper level of the skin?
Yeah, so collagen induction therapy is a really popular thing.
Yep.
For your more superficial treatments, we can use things like the Dermastat, which is a needling technology. Sounds absolutely frightful, but basically what happens is that a small handpiece creates microchannels into the skin, and by creating those microchannels, it stimulates and activates those cells to make new collagen.
Those sleepy cells to wake
absolutely.
up and start doing their job again properly.
Absolutely.
Because the sun puts them to sleep.
Absolutely.
It depresses our immune response at the cellular level in the skin, which is why we develop the skin cancer. But it also puts those cells to sleep that are ordinarily repairing the precancerous cells and preventing them from becoming cancer, and also producing the collagen and the elastin and the ground substance, the hyaluronic acid, the glycosamine, the glycans, all of that substance that gives our skin the beautiful elasticity and softness and suppleness and feel.
Yeah. Another treatment we can actually use, going on the hyaluronic acid, is we can actually use things like dermal fillers as well to replenish the deeper levels of our skin, purely just to hydrate. So it is obviously an anti-wrinkle injection or an injectable treatment. And also we can help to lift and contour when we've got a lot of elasticity changes.
So it's good in the sort of earlier changes when we're talking at a dermal or a skin, deeper level of the skin level, but it's also good when we have those more advanced changes where we're starting to lose that elasticity and the recoil in the skin, and we just need to plump up the tissues again.
Yeah.
Beautiful.